interesting. Jonathan Van Tam and, in fact, I believe Stephen Powis agreed, giving the Prime Minister cover for the regional approach to the different restrictions in different parts to match the level of infection. Well, we're joined again on PM by John Edmunds, Professor in the Faculty of Epidemiology and Population Health at the London School of Hygiene and Tropical Medicine. John, we talk to you, I think, frequently on the days when Boris Johnson has addressed the country. Let's just start on the circuit breaker idea. Wales and Northern Ireland have gone for something quite extreme. Do you think that would be merited in England at this point?
Yes, I do. I think it would. Well, epidemiologically. I mean, I'm only answering on an epidemiological grounds. I'm not answering on economic grounds. But epidemiologically, yes, I do. And I'll explain why. It reduces the infection, the prevalence, the amount of infection in the community. And that's really important. So it's really important for all kinds of reasons. But if I maybe take a minute or so and explain why that's so important. So if you think about Tier 3, if we move into Tier 3, if we all moved into Tier 3 now, then probably at best we'd expect to reduce the reproduction number to about 1. I don't think Tier 3 levels restrictions are going to reduce it to less than 1, and many of us think it might not reduce it to 1, but let's assume it reduces it to about 1. That means that we'll hold the level of infection in the country. If we all did it, we went, not just in Manchester, but everywhere went into Tier 3, we'd hold the level of infection in the country at about the level where it is now. And that means, well, we had 240 deaths reported today, but even if we made a change today, deaths would still go up because, as John Van Tam said on the press conference, they're baked in because people who were infected today or yesterday, it takes a few weeks, unfortunately, to die. And so we would expect the deaths to go up. So, and it's doubling, the death rates are doubling about every 2 weeks. So, and it takes roughly 2 weeks to die. So we might expect to hold the numbers of deaths at a few hundred, maybe 300 or 400 a day. Let's take 400. So that's the level. If we all went into Tier 3, we'd hold the epidemic at something like that level for the foreseeable future.
Yeah, okay.
And that 400 deaths a day over 100 days is 40,000 deaths. Now, if you do a fire break, what that does is it reduces the incidence. If you do it like the Northern Ireland or the Welsh have done, that should reduce the incidence. If you do that for a couple of weeks, perhaps you would half the incidence. So instead of having an incident, 400 deaths a day, you'd have 200 deaths a day, which then over 100 days is 20,000 deaths. It's still an awful lot of deaths, but you save 20,000.
It creeps up again, doesn't it, over time, presumably, because when you release the fire break, it buys you time, and then it goes up again.
It does,
and
yeah.
you have another one in 2 months' time, presumably.
But that's why I think, yes, so you can either do it with repeated fire breaks and you don't have longer-term restrictions, or you do a combination of both where you have a fire break plus some longer-term restrictions. So the longer-term restrictions meaning that you would then hold the epidemiology more or less as it is.
SAGE recommended a fire break weeks ago. Is there any reason to have changed mind that you get to a point where it's too late or there's no point in bothering now?
Well, you wouldn't reduce the incidence to low levels. The reason part of the reason why we suggested it a few weeks ago was then that would have sort of turned the clock back to August when it was much safer in August, and then it also means that hospitals are not overwhelmed because they weren't. They were able to go about their normal business in August. That it's not so easy now. So even if we do a fire break of a couple of weeks now, then we put the level back to the beginning of October. That's still putting pressure on the health service in many parts of the country. So it is much less effective now, and also it's not just pressure on the health service, but it's pressure all over the place, but pressure on the track and trace. Track and trace works much better if you've got low numbers
than if you've got lots of them. And of course, the clever thing about the Northern Ireland and Welsh ones was it coincides with a half-term holiday. And how important is it to you for a fire break to work that schools aren't active?
I think you're giving it the best chance for it to work if schools are closed. I mean, I think evidence is emerging now that secondary schools are more of a risk than we thought that they were. And so I think it makes a lot of sense. If you're going to do it, then do it around school closures anyway. That makes a lot of sense. And again, that's what we said back in September.
Right, okay. Well, that is interesting. Now, there is a counter-argument that says a lot of the data has been massively skewed, the infection data at least, by students, that there are just hundreds of students who are testing positive, and the correlation between towns, some work by the FT, the Financial Times today, the towns that have a university and those that don't, you see a hugely different, divergent pattern. And whether we should be thinking of somehow it being a different experience if it is predominantly a student experience or student-driven here.
Yes, clearly there have been really major outbreaks in universities, and there's a lot of testing as well of university students, and so that maybe inflates some of the numbers a little bit. But I think what you've got to look at is the rates in the other age groups. So if you take, say, the 30-plus age group, not many of them would be students. And so, if you look at the rate of increase in that age group, then that's been going up quite rapidly over many weeks. And that rate of increase in that age group, for instance, predates the return of university. So I don't think it's universities fueling the wider epidemic very much. I think they're probably more confined to the university setting. We still have a generalised increase in incidence right across the country. It is worse in places. It is worse in the northwest. It is worse in places with universities, yes. But we still have a generalised increase in incidence right across the country.
Whose side are you on in the debate over Manchester, Greater Manchester?
I just wish they would resolve it fast. You do need to have a package of measures in place so that people can take these measures. But the longer it goes on, the worse it gets. I mean, I think you've mentioned that it's been 11 days. Well, the epidemic is doubling every 14 days or so. So that's, while they've been arguing, things have got much worse.
Have we got to the bottom, John, as to why across the world, across Europe and parts of the United States, there has been this autumn surge? We spoke to Paul Hunter from East Anglia, University of East Anglia. He thought it coincides suspiciously closely with the return of schools in most parts of those affected countries. Is it winter? Is it temperature? Is it seasonal? I mean, because it's not. We're not really that much of an outlier. It's happening everywhere, isn't it? What's going on?
Well, it was increasing before schools returned. So, we've had a gradual increase. And, it looks like it kicks up, but that's just what exponential increase looks like, So if you logged it and showed it then you'd see it looking more straight. It does increase around September, though. It's not, I think it has increased a bit. It does look suspiciously like schools do play a role, I'm sorry to say. And of course, we've mentioned universities, but it's not just the fact that the schools, there's also sort of return to work that happens after the holidays and so on. So it's a package of things that happen all around the same time. I don't think it's just all transmission in schools at all.